Welcome to this presentation on Medicare Preventive Services. My name is Jody Delcier and I'm with SHIBA of Lane County. Medicare offers many free screening and preventive services to help you stay well and catch issues before they become serious. Today we're going to empower you with information on how to access these services. First, let me tell you a bit about SHIBA. Senior Health Insurance Benefits Assistance, or SHIBA, is a service that provides free and unbiased Medicare information to beneficiaries and their support system. It is funded by state and federal grants and has no incentive to sell clients on any particular plan. What we'll learn today: we'll define preventive services, find out which services Medicare covers, and learn how to access those services. So what are preventive services? Preventive services include exams, shots, lab tests, and screenings. They also include programs for health monitoring and counseling and education to help you take care of your own health. Preventive services are important because they help you find health problems early when treatment works the best. This leads to better health outcomes and cost savings overall. Test your knowledge. What is the main goal of preventive services? Is it A, treating chronic conditions, B, detecting and preventing illnesses early, or C, replacing regular doctor visits? The answer is B, detecting and preventing illnesses early. Next, why is Medicare invested in preventive care? It's in both your best interest and Medicare's to prevent illness rather than treat it when it's more advanced. There are cost savings involved. Early detection and treatment costs much less than expensive treatments later on. It's also about empowerment. Medicare wants to encourage beneficiaries to be proactive about their own health. And lastly, it's about public health. Preventive care leads to healthier communities overall. So what does preventive care look like in different parts of Medicare? Part A covers inpatient hospital care, but there are some preventive services that can happen in that setting. For example, a screening before an inpatient surgery could be classified as preventive care. Part B is the major player in preventive care. It includes wellness visits, screenings, vaccinations, and much more. Medicare's Guide to Preventive Services includes 28 different services classified as preventive, and most have no cost to beneficiaries when the provider accepts assignment with Medicare. Part D covers some vaccines that are not included with Part B, such as the shingles vaccine. Lastly, Part C. Medicare Advantage plans are required to cover all the preventive services that original Medicare covers. Sometimes extra services are covered, such as vision exams, dental cleanings, and fitness programs, depending on the plan. Preventive services usually have no out-of-pocket costs as long as you see an in-network provider. Test your knowledge. Which part of Medicare primarily covers preventive services? Is it A, Part A, B, Part B, or C, Medigap? The answer is B, Part B. Next, let's look at some highlights of the 28 preventive services that are covered by Medicare. First is the yearly wellness visit. Beneficiaries can have one every 12 months, starting 12 months after the initial Welcome to Medicare visit. It includes measurements, a prescription review, cognitive assessment, risk factor assessment, screening schedule, care planning, and personalized advice. Next are vaccinations, including COVID-19, flu shots, hepatitis B shots, pneumococcal shots, RSV, shingles, whooping cough, and all vaccines recommended by the Advisory Committee on Immunization Practices. Next is screenings, including cardiovascular, 1 every 5 years, cancer, including breast, lung, colorectal, and prostate, and a diabetes screening up to 2 per year. Next is counseling. Alcohol misuse counseling, you can have 1 screening per year and up to 4 brief counseling sessions per year. A depression screening, 1 per year. And smoking cessation counseling, up to 8 sessions every 12 months. Next is the Medicare Diabetes Prevention Program, which is a health behavior change program to help you prevent type 2 diabetes. It includes training to make realistic, lasting behavior changes around diet and exercise. Time to test your knowledge. Which one of these is not a preventive service covered by Medicare? Is it A, mammograms, B, flu shots, or C, urgent care visits? The answer is C, urgent care visits. Let's talk about eligibility and costs. Who qualifies for preventive services? Generally, anyone with Medicare Part B. Most people get Part B when they turn 65, but others get Part B at different times, such as when they retire and lose employer health coverage, or when they have been on disability for over 2 years. What do preventive services cost? For most services, there is no cost and the Part B deductible does not apply. Some services, like glaucoma screenings, do have a 20% coinsurance after deductible. Check the Your Guide to Medicare Preventive Services publication for full details. One caveat: your provider must accept assignment. Assignment is an agreement by your doctor, provider, or supplier to be paid directly by Medicare, to accept the payment amount that Medicare approves for the covered service, and not to bill you for any more than the Medicare deductible and coinsurance. Medicare Advantage plans are required to provide preventive services, but they might have other prices and stipulations. Check your plan documents to read the fine print before scheduling your appointment to avoid surprises. Now let's talk about how to access preventive services. First, confirm your eligibility. Whether you have Original Medicare or Medicare Advantage, check in advance to make sure that your service is covered. You can do that at medicare.gov or look at your MA plan's summary of benefits. Some plans have specific eligibility criteria. Next, choose a provider. Use your plan website to find a provider that can administer your service. If you have Original Medicare, ensure that that provider accepts Medicare assignment. Next, schedule an appointment. Contact your provider to schedule the service. Mention the specific service you're looking for example, your yearly wellness visit. Verify the costs involved. Check with the provider's front desk or billing department to make sure the service will be billed under preventive services. Ask about potential costs of additional procedures that might occur during your visit, such as biopsies. Next, prepare for your appointment. Make a list of medications, medical history, and family history. Prepare any specific questions you want to ask, and add any relevant dates and details. Consider whether you have any health goals or outcomes that you're aiming for. Stay proactive. Keep a health journal with notes about the conversations that you have with providers. Record screenings and treatments. Schedule follow-up appointments and vaccinations as early as possible. Add to your health journal anytime an issue arises so you have dates and details handy at future appointments. Test your knowledge. Why would you prepare your family medical history to share during your annual wellness visit? A. It helps providers recommend appropriate preventive services. B. Medicare requires it for billing purposes. Or C. It reduces your copay for the visit. The answer is A. It helps providers recommend appropriate preventive services. Let's talk about fraud prevention as it relates to preventive services. Fraud occurs when someone deceives Medicare and you to receive unauthorized payments. This might look like billing Medicare for services that were not provided, misrepresenting services as medically necessary procedures in order to charge Medicare extra, or offering you free services or tests in exchange for Medicare information, which is then used for fraudulent billing. Here are some red flags to watch out for. Unsolicited offers of free screenings, tests, or wellness checks. This may occur at a health fair, over the phone, or online. The solicitor may ask you for your Medicare information to verify your eligibility, which they use for fraudulent billing. Also watch out for billing discrepancies where a preventive service was billed as a more expensive diagnostic service. And watch out for offers of unnecessary services or tests that the provider can bill to Medicare even if there is no benefit to you. Here are some tips on how to prevent fraud. First, don't give your Medicare number to anyone you didn't initiate contact with. Only share it with trusted Medicare-approved providers or advisors who you called first. Remember that Medicare will not call you unsolicited. Be skeptical of quote-unquote free services. There might be strings attached. Keep detailed notes about your doctor visits and the services that you received. Review your Medicare summary notice or explanation of benefits for services that you did not receive. Here's what to do if something looks fishy. First, contact your provider's office to see if they can explain the discrepancy and answer your questions. If you're unsatisfied with their response, contact Senior Medicare Patrol, or SMP. They will set you up with an advocate who will walk you through the reporting and resolution process. No matter what, stay informed about fraud prevention and resources on the SMP website and with other workshops offered by SHIBA. Here are some resources where you can find more information. First is Your Guide to Medicare Preventive Services. This is a thorough guide published by Medicare that walks you through each of the 28 preventive services that they offer. Next is Medicare.gov. They have a search tool where you can enter the preventive service that you're looking for and find all the information that you need. You can also call 1-800-MEDICARE, where you can talk to a person about your specific situation. Also, consider picking up an SMP healthcare tracker, which is a journal where you can record your interactions with providers and other important details about your health. Test your knowledge with a few questions. First, true or false? Preventive services under Part B are always free to the beneficiary. The answer is false. Some services may have costs if additional diagnostic procedures are performed. Next, how can you track which preventive services you've already received? A. Call your provider. B. Check your Medicare summary notice or explanation of benefits. Or C. Wait for Medicare to notify you. The answer is B. Check your Medicare summary notice or explanation of benefits. Who should you contact if someone claiming to be from your doctor's office calls to offer a free DNA test in exchange for your Medicare number? A. Hang up and call your doctor's office back to see if it was legitimate. B. Call SMP to report fraud. C. Call 1-800-MEDICARE to report fraud. Or D. All of the above. The answer is D. All of the above. That's it for this presentation. Thank you for watching. If you're in Lane County, please feel free to get in touch at willamalane.org/SHIBA.